Get started. So this is basically a quick overview. I talked to Sheila about your quiz, and there's you guys are gonna remember there's environmental emergencies and then special populations on this quiz as well. So make sure you guys review that. So let's get started. So I want you guys to do you guys want me to just talk and or do you guys want to answer the questions? Let me know because I don't want to just walk all over and you guys don't answer all the questions. Oh, what did the chat say? Okay, so I'll just talk, and then so that means people then can kind of just watch this really quickly before they take their test. If you guys have questions, let me know. All right, so the first one. 28-year-old male was struck in the chest with a baseball bat during an altercation. He is conscious, alert, complains of severe chest pain. Your assessment reveals a large area of ecchymosis over the sternum and a rapid, irregular pulse. In addition to applying 100% oxygen, you should. All right, so really we need to look at this and figure out what's the most significant part of this question. And we've got a trauma to the chest, so we've got chest trauma. So we should be thinking, along the lines of cardiac trauma, cardiac tamponade, something to do with that. So now we start looking at our answer choices. A, apply an automated external defibrillator and take his blood pressure. Well, he's not unconscious. He's not dead, so we don't need an AED at this point. Prepare for immediate transport. Okay, we'll come back to that one. And then determine if he has cardiac problems. So that's a possible explanation. But, in the sense of trauma, a medical history just isn't as important, okay? And the reason that's not so as important because the trauma is the one causing, the mechanism of injury is the issue. So we could ask him if he has cardiac problems. He's complaining of chest pain. Okay, but he just got hit with a baseball bat right there. So that's kind of an iffy one there. And then D, apply bulky dressings to the sternum. Well, the question didn't really say anything about, paradoxical movement of the chest and really say about rib fractures or anything like that. So we're not really thinking along the lines of that. So the correct answer is going to be B, prepare for immediate transport. So this kind of goes back to your algorithm. After your primary assessment, we have to make a transport decision, okay? So, you go through your primary assessment, and the last thing about that is determine disposition, determine transport. For this guy, he's conscious alert, but complaining of chest pain. So we have to think of a cardiac issue at that point due to chest trauma. That's significant, okay? The rapid irregular pulse, meaning that it's symptomatic now. So we have cardiac problems with chest trauma, that's symptomatic, okay? So symptomatic cardiac problems with chest trauma, we should always be loading and going, okay? We don't want to sit around and wait around. Any questions on that one, guys? Oh, all right, sweet. 37-year-old male was pinned between a flatbed truck and a loading dock. On exam, you find bruising to the chest, distended neck veins, bilaterally diminished breath sounds, bilateral scleral hemorrhaging, and what is the best next decision? Okay, so flatbed, he's pinned, or he was pinned. Okay, so what should we be thinking there? Crush injuries, right? Now, we kind of go on to the physical exam. We find bruising to the chest, distended neck veins, bilaterally diminished breath sounds, and then bilateral scleral hemorrhaging, okay? Now, scleral hemorrhaging, what's that indicative of, okay? Well, it could be rising ICP, it could be rising pressure. I mean, that's indicative of something, but in itself is probably not life-threatening. It's more indicative of another life-threatening issue. Distended neck veins, okay? That's important, all right? Now we have some sort of obstructive shock potentially. Bilaterally diminished breath sounds. This is the key here, okay? So bilaterally diminished breath sounds. So in chest trauma, what are we looking for? We're looking to see if there's an airway compromise, something that could potentially alter our ABCs, right? We always go back to our ABCs. So if based on that information, what our answer choices, right? A, aggressively manage the airway. B, request a paramedic ambulance. C, perform a secondary assessment. D, suspect a severe pneumothorax. Well, so this one's kind of hard because there's three answer choices that could be correct. A could be correct, B could be correct, and D could be correct. We could suspect a severe pneumothorax. That's okay. But as far as the decision, we need to know how to treat this patient. Okay, so we can suspect something, but that's okay, but we need to know how to fix it. Okay, so requesting a paramedic ambulance, that could be a possibility. However, there's something more significant here that we need to recognize, and that is aggressively managing his airway. So what the part of the question that points us towards the correct answer, which is aggressively managing his airway, is the diminished breath sounds. Okay, so anytime that we have a question, they're going to throw a bunch of different stuff at you. They're going to have different issues, and you basically have to triage the issues and go, what can I fix as an EMT? What can I fix, and what should I focus my attention on? Okay, and I guarantee you, airway. If they have something that has something to do with their airway, it's C-spine, then airway, then circulation. Okay, I mean that's your three things. All right. Anytime that it's going to say what should you do next, and it's a trauma, and it says probably apply C-spine, that's probably going to be your right answer. Okay, because again, we think of an algorithm. What's the first thing we do on a trauma? Get C-spine. Okay, or at least hold manual. So again, on this one, we recognize the diminished breath sounds as the most life-threatening issue with this guy. We need to aggressively manage his airway. Okay, so don't get. They're going to give you a bunch of stuff, especially with this multi-system trauma. You have to be able to triage what is the worst thing that's going wrong with this patient, and what do I need to do next to treat it. So anyone got any questions on that one? Sweet. Okay, question 3. Following blunt trauma to the chest, an 18-year-old female patient presents with respiratory distress, reduced tidal volume, and cyanosis. Her blood pressure is 95/80, heart rate 110. All right, so based on her vitals alone, what do you think that is? Can one of y'all tell me what, just based on her vitals alone, what is that indicative of? Hypotension, tachycardia. What do y'all think? Oops. Gave you the answer. All right, well, since y'all have been sucking at responding, it's shock, okay? Hypotension with tachycardia, that is the characteristic sign of decompensated shock, okay? Now, blunt trauma to the chest, it's another one. An 18-year-old female patient, respiratory distress, reduced tidal volume, and cyanosis, okay? With that vital sign. She is in shock, all right? So cyanosis, the skin color, that's a big sign. She's not getting perfusion. Her reduced tidal volume, that's a big issue. And then respiratory distress. So out of the respiratory distress, reduced tidal volume, cyanosis, and then her blood pressure and heart rate, what is the most indicative or the most serious thing wrong with that patient? Okay, because that's going to tell us our answer choice. So the most significant thing is the reduced tidal volume, okay? If we cannot get a good tidal volume, our ventilation is an issue. Therefore, our airway is an issue. Therefore, we need to do something to fix that, okay? So on our answer choices, we have apply 100% oxygen, immediately transport. That's a possibility. Place her in a supine position, elevate the lower extremities. Well, she is in shock, sure. However, that's not going to be the best decision, okay? Because we're not fixing, there's something wrong with her that we're not fixing by doing answer choice B. Letter C, perform a rapid head-to-toe physical assessment. Well, okay, but as far as your head-to-toe, when you recognize something that needs to be fixed, ABCs, or there's a life threat, what do? We stop and fix it, okay? So based on this patient, we have identified a life threat, and that is her reduced tidal volume. All right, so we need to provide positive pressure ventilation, and that's going to be the correct answer because we need to fix that ventilation. Just applying 100% oxygen is not going to fix that, okay? Because you got to think, with a reduced tidal volume, you have a ventilation issue. You don't have an oxygenation issue technically. I mean, technically you do on this patient as well, but you have to have good ventilation before you can even attempt oxygenation. All right, so if they're not getting air even into the lungs, we need to be able to do that. So applying 100% oxygen is useless if we can't get the air into the lungs. All right, so that's where the positive pressure ventilation will come into the scenario. So again, we have a question. So similar, immediately visible life threats come before head to toe. Yeah, well, I mean, your head to toe, what's the point of your head to toe? To identify the life threats. So if you identify a life threat immediately, then you're going to take care of it. All your head to toe does, yes, it's a systematic head to toe, but it's to identify the life threats and fix them. So if we already know about a life threat without even having to start our head to toe, then yes, you would immediately fix that. So like for instance, if I see arterial bleeding on the leg, just walking up to the patient, I'm not going to start doing my palpation of the head and then check the pupils and everything before I would fix the arterial bleed. Does that kind of make sense? We teach it to you guys in a systematic fashion, but if you identify a life threat already, then you go ahead and take care of that. Does that answer your question, Braxton? Okay, cool. Again, this question is really important because you want to read the question, okay? Reduced, again, there's only one part, and trauma, we're going to do this a bunch to you. You know, we're going to give you a bunch of different stuff, but you have to identify the most life-threatening, and then that's going to be your answer choice. Oops. Oh, I guess I didn't put a... Oh, well, you already know the answer to this one. You respond to a house explosion with a fire. You're directed to your patient who has soot on his face. The patient states sheepishly that he was lighting his charcoal grill and accidentally poured gasoline on the grill, which resulted in an explosion. He is conscious and alert with a second-degree burns to both arms, hands, and face. What is your primary concern? All right, so this is burns, okay? Anything that has any burn to the face, you're going to always be thinking airway compromise, okay? Airway compromise is gonna be what kills this patient, and that we need to make sure that this doesn't affect them. Okay, so airway compromise is going to be your biggest life threat here. Secondary explosion. Well, I mean, he was pouring the gas on the grill. He's not continually pouring the gas on the grill, so it's probably not going to be an issue. Infection. While this could be a serious thing with second-degree burns, at the end of the day, you know, we've got to realize that the infection is not going to kill them first. The airway compromise will. And dehydration, again, will affect them, but the airway compromise is going to be what kills them quicker. Your job as an EMT, guys, is to literally figure out what's going to kill them the quickest, and then try and remedy that. All right. So the airway compromise is always going to, on an airway burn, any burns to the face, is always going to be most indicative. Inhalation burns. Okay. So a lot of times you have a guy going through a house. And he inhales hot air, well, that burns his airway. Okay, so that's also going to be an issue. So anytime burns, guys, your number one thing should be ruling out airway compromise. All right, you arrive on the scene of a two-car MVC, motor vehicle collision, motor vehicle crash. There's a bunch of different things. Everyone uses a different term. And the incident commander directs you to the first car, which was rear-ended by the second car. The driver is alone in the vehicle and is wearing a seatbelt still. Good job, he's wearing a seatbelt. He's conscious, alert, and complaining of neck pain. There's no other injuries noted at this point. What's your next move? Okay, so think about this scene, right? You've got a two-car MVC, which is typically the case. You're going to a guy, he's restrained, okay? Again, your MOI here, you got to look how badly it damages the car. You know, rear-ended, what are we thinking here, okay? You got to think of that mechanism. I mean, he had whiplash. He could be a spider on the front dash. We don't really know. All right, so your next move, and let's kind of go down on these answer choices. Rapidly extricate the patient to a long spine board. All right, maybe. Place the patient on a short spine board and extricate. Okay. Take manual stabilization from the rear seat and apply cervical collar. Okay. Perform modify adjust draw thrust. Okay, D's out. You're not going to do that. He's conscious and breathing. A, B, and C. It's all about extrication. All right. You know, in this patient, we have to do what? We always, on every single extrication, we take spinal precautions. Every single time. Okay. What's the one thing that we have to do to take spinal precautions? Every single time. Is manual stabilization, and then C-spine, correct? Is that what they said? Hold C-spine, right? So that immediately places you've got one answer choice. Take manual stabilization from the rear seat and apply a cervical collar. So that's your correct answer. So guys, you've got to realize that you may not know the answer to the question, but look at your answer choices. You know for a fact that there's one thing you have to do on every single extrication, whether or not it's a spine board, whether or not it's a short spine board. It depends. But on every single one, you're going to take manual stabilization. Okay, so that's why that's going to be C. Any questions on that one? On a warm, sunny day, you are dispatched to a road race site for a runner down. Oh, here we go. By the way, guys, if you ever work a marathon or anything like that, trying to get in there is a pain in the butt. So when you guys first work a marathon, let me know because it sucks. All right, so you find a 25-year-old male lying unconscious on his back in his running clothes. His skin is red, dry, and very hot. Heart rate 120, respiration is 20, blood pressure 100/60. How should you treat this patient? Got a question. How should we treat this patient? Okay, so think about it. You're on a warm, sunny day. You're at a marathon race. You got a 25-year-old. Okay, so it's not like a 70-year-old. I mean, it's a young guy. He's unconscious on his back, running clothes. Skin conditions: red, dry, very hot. Vitals are fairly normal. He's kind of hypertensive, but the biggest thing here is that the conditions and the skin condition. Okay, so does anyone know what this guy has right now? Come on, it's super easy. Heat stroke, right? Definitely going to be heat stroke. Honestly, you can pretty much just tell straight away. Oops, I keep doing that. Kind of going forward. Well, you know the answer. But the biggest thing here, guys, is that you're going to a runner down at a marathon. He's 25, unconscious, in running clothes. He was running. Guys, marathon runners, they push through heat exhaustion. They push through heat cramps. They keep going until they literally go unconscious. So we've got to think, when you're going to a marathon, you're going to run either dehydration or a heat stroke. That's a big one. So just given your dispatch disposition, you should probably know what you're going to. But his skin condition, red, hot, and dry, that's a characteristic hallmark of heat stroke. Heart rate's tachycardic, blood pressure's kind of low. So the way we treat him is going to be apply ice packs to the groin, neck, and armpit. He's unconscious. We're not going to give him water, okay? Why are we not going to give them water to an unconscious person? What's the big issue with giving an unconscious person water? What are we worried about? Can't protect the airway, right? So aspiration is a big thing. The same thing with your glucose and your diabetic patients, right? We don't want to be giving glucose to altered patients because of can't protect their own airway. Okay, so we're not going to give them small sips of water. We could manage his airway. Well, he's potentially his respirations are okay right now. A little high, but nothing major. So we probably don't really need to manage his airway and administer glucose. Well, no, we're not going to do that. So again, heat stroke, active cooling. We've got to active cool him. He's unconscious, so an altered mental status at this point due to the heat stroke. That's a characteristic sign of active cool. Alrighty. Whoops. Gosh, keep knowing the answers. Alright, a 21-year-old male was thrown from his motorcycle when he rear-ended a car that was stopped at a red light. He was wearing a helmet, which he removed prior to your arrival. That's good. Takes the work out of it for you. He is unconscious now, though, and has closed deformities to both legs. His skin is pale. Heart rate is rapid and weak. Respirations are rapid and shallow. In addition to managing his airway and protecting his spine, you should. Okay, so let's kind of go back to the start. We've got a 21-year-old male thrown from a motorcycle. So just in itself, we know the mechanism of injury is going to be pretty significant. Okay, he was ejected. He was wearing a helmet, which was good, but apparently he removed it prior to your arrival. So I don't know if he removed it or a bystander removed it. I'm not too sure. But he's not wearing one, but there is one beside him, I guess, and on scene, so you can fairly assume that he might have been wearing it. He is unconscious and has closed deformities to both femurs. Skin is pale, heart rate is rapid and weak, respirations are rapid and shallow. So, we've got lack of perfusion, right? Skin is pale, heart rate is weak, rapid and weak, and respirations are rapid and shallow. So, we're bad across the board. Is there anything specifically here that we should be worried about that we can fix right then and there? He is just all sorts of messed up, okay? You know what? Yes, we could provide some ventilation support, but you know his heart rate is rapid and weak. He's probably got internal bleeding because of his femur fractures. He's unconscious. So for this patient, what is our priority? For a patient with a multi-system trauma, unconscious, what should be our priority? Anyone got an answer? Okay, well, to save time, an unconscious multi-system trauma needs rapid extrication, rapid transport. Okay, there's absolutely nothing we really can do on this scene to really save his life. If it's just his respirations were kind of messed up, but he had no other real injuries, then we could fix that. Okay, if he just had the closed deformity, well, that's easy. If he was conscious, but the fact that he's unconscious, multiple system trauma, we need to get him going and get transport at least started. Okay, then we can assist respirations and do all that as well. So going to our answer choices here, apply traction splints to both legs, keep them warm, and transport without delay. All right, so this could be the possible answer, right? You know, he's got deformities to his legs, his femurs, so traction splint would be indicated. We're going to bind his legs together on a long spine board, keep them warm, and transport without delay. All right, so use the long spine board as a body splint. And then C, splint each of the deformed femurs with splints, keep them warm, transport without delay. Pronounce them dead. Femur fracture is typically going to kill you. So D is probably out. Well, he's not dead yet, and we don't pronounce death. So A, B, or C. So what do y'all think for this one? And this is kind of where you have to really start to think about the priority of this patient. What is our priority? To get him where? To a trauma center. Okay? So we could apply traction splints to both legs, but does that answer choice give you anything about a long spine board? Okay? We've got to protect his spine, right? So looking at your answer choices, it would be B. Bind his legs together, put him on a long spine board, keep him warm, and transport without delay. So this is where you have to look at the question. This is a National Registry question pulled right from the book. So bind his legs together, put him on a spine board, keep him warm, and transport. That does everything. It splints his legs, put him on a spine board, keep him warm, and transport without delay. Now, the best answer, in my opinion, would be apply traction splints, put him on a spine board, and get him going. Per y'all's National Registry, that's what we would do. We practiced that the other night. However, there's no answer choice giving him that. And it depends on local protocols and what you're actually going to do. So binding his legs together will splint his legs. Putting him on a spine board will keep his C-spine and spine correct. And then keeping him warm is important because in trauma, we want to keep these patients warm. We want to prevent hypothermia. So, and then transport without delay. So have we got any questions on this one? The idea, though, here is that we need spinal precautions, but to read your answer choices, because y'all would have picked A, but think about it. Just applying traction splints to both legs, that's not going to do any. That's not going to help his C-spine, or it's not going to help spinal protection. Any questions? All right. So again, simplify it. We need a backboard, so there's only one place with a backboard. 22-year-old female was ejected from her car after striking a tree head-on. As you approach her, you note obvious deformities to both her femurs. She is not moving, does not appear to be conscious. You should. Okay, so ejected, kind of the similar question. Ejected, deformities to both femurs, not moving, does not appear to be conscious. So this question, though, the answer choices want to know what you would do first. So this should be pretty simple. What do y'all think? It's asking what you would do first. And this is something that y'all have got to get in your heads on how to answer these type of questions, because technically A would be right, C would be right, and D would be right. Technically. But what would you do first? D. Perfect. Stabilize your head, perform that primary assessment. So when you guys answer these questions today, you've got to think, okay, there are multiple. It's not, you can't just recognize which correct answer choice looks correct, because half of them will probably be correct. So you have to think, what would I do first? And go back to that algorithm. When you guys go back to that algorithm that they gave you, that's like the first or second day of class, that gives you a primary assessment, secondary assessment, C-spine, and all that type of stuff. Okay? So D is correct. Which injury should be managed first? Oh, actually, let me go back. Guys, everything today, you're going to take manual C-spine first and then complete your primary assessment. Okay, so keep that in mind. That is your order of the way you're going to do it. So keep that in mind for today's quiz. Which injury should be managed first in a patient with multi-system trauma? All right, so it kind of goes back to that triage thing. We have to figure out what is going to kill them the quickest. Okay, so what do you guys think? There's 2 of them here. Well, 3 of them. Well, I guess all of them. Oh, going back to a previous question, ABCs first, then additional resources. To be honest with you, no. I think, and again, quote me if please tell me if I'm wrong on this one, but I believe additional resources is part of your scene size up, which is done before you actually make patient contact. So I think it would be your additional resources first, because that's part of your scene size up. So for that one, yeah, does that answer your question? Okay. So for this one, what again, we have to, as EMTs, we have to triage. What is the most important thing that we have to be managed first? It's all about order, right? We know how to manage all of these things, but what do we, if we had a patient with all 4 of them, what are we going to manage first? So what do you guys think? Going back to ABCs, because yes, bilateral femur fractures are pretty serious. A large open abdominal wound sounds pretty legit. So what is the greatest life threat? What has the potential to be the greatest life threat? Okay, so we're probably going to think D, but a large open abdominal wound, that could just be a laceration. But there's one thing that should just, it should automatically trigger your ABC minds. So letter C, bleeding within the oral cavity, right? So we have fluid within the mouth. So we have to be able to suction this, okay? So again, it goes back to ABCs, right? Bleeding in the oral cavity is going to be an issue with an airway, so that's going to trump. I can guarantee you guys, if there is an airway issue on the question, it's going to be between that or C-spine. I mean, and they're typically hopefully not going to give you one with both. But again, you probably hold manual while you fix the airway. So you've got to realize, guys, that airway stuff, that's got to be on the forefront of your minds when you're taking these quizzes. ABCs, it is that simple. So bleeding within the oral cavity is going to be your worst because of the airway compromise. Fluid drain from both ears. Yeah, he could have a skull fracture. He could have a cerebral injury. Yes, that's bad. Femur fractures. Yeah, that's pretty bad. A large open abdominal wound. Yeah, that's bad too, but that's not going to kill them as quickly as choking on their own blood. All right. Oh, man, I forget to do this. All right, so what is the most likely life-threatening for an adult patient? All right, so bubbling wound from the chest. So what could be a bubbling wound from the chest? What is that indicative of? It's a sucking chest wound, right? So a pneumothorax is going to be the potential complication from this. So an active bleeding from the forehead, well, the forehead, you haven't got any major arteries up in your forehead. I mean, well, you do have arteries there, but there's nothing that can't be controlled by direct pressure. However, bubbling from that chest is going to go back to that airway issue, right? And if you can't breathe, then you can't breathe. And so ABCs, airway is before everything else. So go back to that. Airway bubbling from the chest is going to have a pneumothorax, which is going to make you not be able to breathe. Any questions on that one? And even the forehead, guys, it's going to bleed a lot, but it can be controlled pretty easily. All right, so that's all the questions we have. Do you guys, real quick, let me move this. There are other things that I want you guys to review before your quiz, your rule of nines. You're going to have, I guarantee you, you're probably going to have to calculate a rule of nines question, or at least have something about rule of nines. So on the next one, I've got actually a rule of nines thing that you can look at. So I'll hold that. And I'm going to post these slides as well so you guys can look through them. Environmental emergencies, don't forget about those. They're not technically trauma, but it's going to be on this quiz probably. Rules of splinting. So what are the rules of splinting? PMS before and after, right? Keep thinking that. Splint above and below, PMS. Always go back to your PMS because that's how they'll get you. Critical fractures. Okay, so life-threatening fractures. So off the top of your head, what are the most life-threatening fractures? To the long bones, right? And what makes a fracture life-threatening? Blood loss. So we've got a humerus, we've got our femur, we've got our tibia, pelvis. A pelvic injury, guys, like I said on some of your skills days, that's going to kill you very, very quickly. You have a lot of space in your pelvic bowl that can lose a lot of blood. Types of head injuries. So just go over the different sorts of head injuries. I'm not going to go over all of them right now. Know the differences between the type of injuries within your brain. So the brain bleeds, epidural, subdural, different types of that. Basically, just know the layers of the brain. And then special patient populations, that's going to be on this quiz too, specifically probably about trauma, but still have an idea about how to answer those type of questions. So do you guys have anything that we need to go over before we're done? I wanted to kind of keep this short and sweet so you guys can get a quick review before your quiz. But the way to approach this stuff, guys, is you've got to look at your question. You've got to look at the priority in which you're going to deal with it. Go back to what you think, well, not what sounds the most, but what you know from your ABCs, from your primary assessment, from your everything like that, what's going to kill them the quickest, okay? Think of it as like, a C-spine injury. If you have a C-spine injury, then you stop breathing altogether, so that's technically airway. All right, you have suction, you have blood in the mouth, you need to suction that. That's airway. If you have a pneumothorax, that's potentially an airway. So always go back to airway, breathing, and then circulation. Your ABCs is going to be critical. Always think about manually stabilizing that patient on the C-spine. That's really, really critical as well. Is there any questions that you guys have that you think the group should know or anything like that before we jump off? Nothing? Okay, well, I hope this guys kind of helped. If you guys have questions, let me know. Let me know in the group chat. And I'll see you guys around 6. Good luck. Oh, how do I end this thing? Okay, thank you guys.